This video is going to show you how to treat a tension headache. There's going to be a variety. I'm going to show you a one-person technique and a two-person technique. Really though, it's best to have two people. So my recommendation is to find a dark office, conference room for example. Go ahead and lay down on a conference room table, turn off the lights, and then just teach somebody else how to do this. Spend 5 minutes on one person, switch, and then 5 minutes on the other. It'd be a good break. Really, the tension headache is kind of a constricting, sometimes throbbing feeling. It's caused by tight muscles in the back of your neck, typically from sitting there at a desk for prolonged periods, from studying by looking down. So to treat a tension headache, really it's best to have two people, but this tension release that I'm going to show you for the beginning, you can modify to a one-person technique. It's a little more difficult, but I personally use a little metal rack. I think it's used to hold magazines, but I just stick it on the back of my neck and relax. So for this, the tension release, what I'm going to be doing is I'm going to be lifting up the patient's head and feeling for a little protuberance, a little point in the back of the patient's head. This is called the occipital protuberance. So once I've found that point, I'm going to stick both of my little fingers on it. I'm going to move them now down towards the patient's feet, just about an inch, maybe a half inch to an inch. So I'm going to find that point, put two little fingers on it, and move it down towards the patient's feet slightly. I'm going to spread the rest of my fingers out along the lateral margins of that. So I'm just going to put my little fingers there, and then I'm going to put the rest of my fingers in place, just lateral to the pinkies. So now I kind of form like a straight line with all my fingers. Now notice my fingers here are going to be straight up and down into the patient's head. And when you do this position, so all my fingers are slightly below that protuberance. When the patient is in this position, I'm going to let the patient rest on these fingers. So I kind of create a little line. What this line does is it allows the muscles to relax. The dural attachments to your head, where your muscles attach to your skull bone, when you put your fingers here, it causes the muscles to relax. Those muscles no longer have to hold the head up, so they are able to relax. Those muscles being tight is what actually causes some of the tension headache. So this technique is a good way to start. If you're really not getting anything, what I recommend doing is go ahead and have the patient relax all the way. Just go ahead and let me hold all your weight. Find that protuberance, that little point in the back of the head. Move down towards the feet, 3-4 inches, and just relax. Just rub. Just rub the muscles for 5-10 seconds. This helps relax those muscles to begin with. If they're too tight, you're actually not going to get a release. But if they're too tight, you can just rub them, hopefully get them to relax a little bit. Once they've relaxed, again, fingers at that point, go down a little, form my little ridge. My fingers are straight up and down, and then I'm going to let the back of his head kind of melt into my palms. Because my palms are facing up right now, it's kind of going to melt into my palms. So I'm going to do this, 2-3 times. Start up, maintain good pressure, and just let his head naturally kind of melt into your hands. It may take 5 seconds, may take 10 seconds, but the more you do it, the quicker it will get. And once you know the technique, this really should take 30 seconds at most, even with having to rub his muscles to begin with to get him to relax. So that's one technique. What I do is I find a metal bar, rest that metal bar right below my occipital protuberance, and just relax. That's one way I get rid of a tension headache myself. I've had quite a few hours of studying. Another technique, this is now a two-person technique. The last one was a one-person or a two-person technique. This one is a two-person technique, so I recommend finding a coworker or a friend to help you with this. I'm going to be standing next to the patient. I'm going to place my hand that's closest to his head on his forehead. I'm going to place my other hand, I'm going to reach around behind his neck, and I'm going to find the midline. And at the midline, you're going to notice that there's some bumps. Those are actually his vertebrae, and they're going to be the spinous processes of the vertebrae. They're going to be midline, so in the very middle of his body. I'm going to reach around, and I feel those spinous processes. Now, what I'm going to be doing is I'm going to be going just laterally, towards his arms, kind of laterally, so this way. about, half an inch or so. So I'm not on those spinous processes, I'm just lateral to them. And what I'm going to be doing is I'll be pulling up and out, up and out. So I'll be always starting at that just lateral to the spinous process place, but I'll be going up and out, up and out, up and out. And I'm going to be working up and down. So I'll be starting kind of up by his ear, up and out. And I'll be working down towards his shoulder, go up and down a few times. What this does is as I'm pulling on that muscle, it causes it to relax. And that is our goal. Muscles typically cause this tension headache. When your muscles have to support your head in a position, whether you're sitting at a desk or sitting down studying, whatever it may be, those muscles get tired and thus they tense up. Once they're tense, they pull on the dural attachments to your skull, thus causing a tension headache. So you kind of feel that constricting, like 2 in the afternoon feeling. So this is a single-sided technique. I just worked on my patient's left-hand side, so I need to switch. I need to do the opposite side. Make sure you don't just treat one side of the patient's neck. You need to treat both sides. So again, I'm going to find the midline bones, go that way just slightly, up and out, up and out, up and out, up and out. So once you get this technique down, it really should take about a minute, I would say, to get both sides. So 30 seconds on one side, 30 on the other. So we're at about a minute and a half of treatment so far. Last technique is, again, going to be a 2-person technique, sitting at the head of the table here. And we're going to be dealing with the trapezius muscle. The trapezius muscle starts in the lower back or in the mid-back, kind of comes up in a trapezoid shape, just like this. And it forms a triangle here at the neck. And at the tip of this triangle, at the very back of the neck, is where it attaches to the skull and the upper cervical vertebrae, causing tension. So if that trapezius muscle is tired, it'll get tense, it'll cause a headache. What I'm going to be doing is I'll take a claw stance, form my little claw, and stick it as far back as I can, and I'll kind of grab the patient's trap muscle, the trapezius muscle, also known as the trap. So what I'll be doing is I have my claw in place now. So kind of the meat of the trapezius is between my claw. I'll be pinching, kind of pinching like this, not too hard, because if you actually pinch the muscle too hard, it'll cause it to tighten up even further. I'll be kind of doing a claw motion just like this, where it's a rhythmic, kind of slow, but nice and firm, but not too firm motion. And what I'm going to be finding is finding tightness in the trapezius muscle. So I'm going to start immediately towards the patient's neck. I'll be working laterally towards the patient's shoulder. I felt it a little tighter here medially, and you're going to try and find a tight spot, and you just want to hold it. You don't want to put too much pressure, again, remember. But if you just do a good amount, a fair amount of pressure, if your friend or patient looks like they're in pain, loosen up a little. But you just want to hold it. Hold it for, 5-10 seconds. And that should cause the muscle to relax. If it doesn't, if it still feels pretty tight, what you can do is you could add a slow, gentle, kind of rhythmic pulse to it, all while maintaining pressure. Your goal is to maintain pressure while relieving the tension in the trapezius. And again, I'm going to work my way laterally, causing the trapezius to relax. So these are 3 different techniques that you can use that I personally like to use to relieve a tension headache. I've logged a lot of hours of studying in my life through medical school, through undergrad, and I found that these techniques really do help relieve a tension headache. They help the muscle relax that is attaching to your skull and your upper neck. When you have a tight muscle attaching to your skull or upper neck, it'll cause that 2 in the afternoon tension headache feeling. So hopefully these techniques you'll be able to share with a friend. Once you get these down, 5 minutes tops per person, switch, and again, 5 minutes again. Well, it's a 10-minute break, and it helps get rid of that headache. Hope this helped.